Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I have Jared Pierce on the line, and he's CEO and founder over at Unity Preferred Network. Jared, welcome to the show.
Thanks for having me.
All right, so excited to get into today. We're going to be talking about how innovation is transforming healthcare networks, addressing industry challenges, and building a better model. So we're going to be talking about some healthcare. But before we do that, Jared, how did you get into this business? Like, where did all that start for you?
Yeah, actually, funny enough, started working in the healthcare industry at 17 years old. So I started
wow. So you were young in the industry. Go ahead.
I was. Yeah, I started in my senior year, middle of my senior year of high school, contracting doctors and calling hospitals and medical providers all around the country. So it's
interesting. So you were on the phone working. So what was that like to be so young, like doing that? And that's interesting. Was your voice more mature, or were they like, what is this kid calling me for? No.
Yeah, no. Luckily, I've always had a deep voice, I guess, so that worked out in phone sales. And I always had an entrepreneur spirit, so I liked the idea of making money early. And I had some big goals early in life and found a really good opportunity and ran with it and fell in love with the industry.
Wow, that's interesting. And so fast forward me a little bit. Were you always entrepreneurial too, by the way? Because this seems like it's a pretty entrepreneurial start as well, even though presumably you were an entrepreneur at that point, like working for somebody else. But like, were you always kind of had that entrepreneurial bent?
I was, yeah. And I knew I wanted to work for myself. I knew I wanted to be my own boss. And
how'd you know that?
I guess maybe stubborn in a good way. And I didn't want to abide by a schedule. I wanted to, always work. And again, I'm very passionate what I do. And luckily I love what I do. So I don't really even consider it a job. It's kind of I guess a good addiction.
Was that kind of like in the blood, like other family members or other things, like other people you watch be an entrepreneur? I'm always curious on how people get there.
Not really. No, I mean, my dad was a therapist and my mom worked in real estate, and they worked good and hard, but I guess I was always chasing the dollar, I guess, really early in life, very money motivated. And again, I think I was inspired by the individual that I first worked for. He was a entrepreneur, worked in many different fields in the finance, and was a sports agent, and also built a network that I helped him build. But really, I just wanted to, again, I think, become independent and be successful, and not be told what to do, I guess, in a good way.
Yeah. And did you know that you'd stay within healthcare? Like, did you just kind of have a fit for that in terms of an industry or niche, or was that like it just kind of happened over time? I'm curious.
I did. I remember the first job that I got handed, and I remember it was like calling hospitals and asking for their physician roster. And I think the previous person that did the job only got, 10 or 15 in 1 month. And I was still in high school, so I wasn't working full time. But my first month on the job, I got 65 rosters. And,
wow.
And so after that, and of course, there was a bonus tied to it as well.
Yeah, so you were hooked. You're like, wait a minute, if I do good, I get paid? Like, let's go.
Exactly. So I would set the bar pretty high.
The adults there were probably not that happy with this freaking wonder kid. Like, what the heck? You're making us look bad.
Yeah, no, they weren't. I soon became their bosses, we'll say.
Yeah, no, I mean, as it's the circle of life, we're not going to go to Mufasa today, but no.
Exactly.
So let's fast forward a bit. So Unity Network, like how did you get the idea for this, or where did this all come about? Like Unity Preferred Network, like how'd that come about?
So I was in the industry for now over 20 years. I was kind of just staying on both sides of the aisle, I guess you could say, because I've also managed a revenue cycle management company in billing where we did the contracts and rev cycle for surgery centers and substance abuse clinics. And I've also then worked on the PPO side and other cost containment solutions. So I understood both sides. And unfortunately, the older networks we were now still competing against, and that I knew from day one getting in the industry, they stayed stagnant, and they were relying on outdated agreements that really failed to deliver any savings or new growth. And I knew that Unity could immediately provide a better service and less noise for all parties involved. So the newer models that also maybe were developed really didn't even have direct contracts. They were really just a algorithm that would apply without a legal binding agreement to the medical community. So we're dealing with reimbursements and legal contracts, and yet here they are just applying their own math, hoping that doctors don't catch this underpayment, or they could throw legal action at them or try to fight it, because a lot of these companies were backed by big private equity. And because of my love and being dedicated to both sides of the house, I knew that the provider community was kind of being taken advantage of. And I knew that I could create a solution that would still apply great savings, no noise to the member, and eliminate any issues of balanced billing, but actually do this on a secured, legitimate signed contract.
Yeah. Before we go further into the benefits and the problem you're solving, go a little bit further into the flaws. I don't want to assume that people understand like where exactly this is broken.
Of course. So it's really broken with United, they call it BUCA. So that's Blue Cross, United, Cigna, Aetna. Of course, your household insurance carriers' names. And what they do is they have direct contracts, but they're not actively growing a network. So you buy insurance and you want to go see a certain provider. You don't just get to go and nominate a provider and say, hey, I want to go to Dr. Pierce. Unfortunately, they say this is where you're going. And if you go outside of here, you're going to pay for it, and nothing even goes towards your deductible.
And that's that.
And unfortunately, let's say we even do give you a provider that you supposedly can go to. For some reason, if we don't like what's happening, or we don't like the build amount, or we just want to play the boss, unfortunately, we're going to deny the claim. We're going to cause issues so that, unfortunately, you have to now deal with this on a cash pay basis. So you're almost wondering, like, what am I even paying for? If I can't go anywhere I want, I'm punished even if I do go to who I'm supposed to, and every single year my deductible gets bigger and my medical premium gets bigger, and I usually never even hit it. So I'm just basically paying money to an insurance carrier that is going to pick and choose when they want to let my healthcare needs be approved. And so what we did was we said, let's build a network that is constantly growing, that is customized to the insured member's needs, that allows members to nominate providers, that provides steerage mechanisms, and ultimately incentivize the members and the provider for receiving and treating our members. And something that, again, is not going to go up in cost every year. And there can be, again, incentives so that there is certain innovative brokers and health plans we work for that if they do go to a Unity provider, they don't pay anything towards their deductible. There's no out-of-pocket expense. So it's really incentivizing those members, not punishing them for using the directory, which ultimately is customized to their needs and their requests.
Now, I don't want this to sound kind of too obvious, and I'm not putting you on the hook for an answer, but is it complacency? Like, why wouldn't the existing providers continue to actively grow their network? Like, what you're saying right now sounds like common sense. Is it like, is there a reason why they don't continue? Like, it's like, okay, when you said this, I'm like, okay, that's smart. Like, continue to provide more options, provide like this. Why wouldn't they?
Or why don't they? It's complacency, and it's also the consumer feeling it's the consumer thinking that I have to have this big brand insurance carrier on my ID card in order to get care.
So brand. Yeah. Wow, it's the Coca-Cola of like whatever. Like wow, interesting. Go ahead, continue.
and you have also the older community that's been accustomed to this, that they think this is the only way I can get to my hospital. And even if it's my knee, or if it's my nose, or if it's my eye, or if it's my ear, whatever's ailing, I need to go to the hospital. And that is, again, just a unfortunate pattern that they've created in their life, where ultimately a lot of these care and needs can be done in a direct primary care model or an urgent care clinic, or the specialist that actually has one center for this exact ailment. And so these costs continue to rise because, again, the hospital is going to bill what they have to bill because they're a much bigger entity. And unfortunately, what people don't realize is you're now going to go to a hospital where you're going to be exposed to sickness or have readmissions or, just other complications that can happen in a hospital setting that might be better, even if it is a surgery, in an ASC or outpatient surgery center. And again, we sign up hospitals. We love, of course, our hospital community, but there's a lot of things that can be provided outside the hospital setting, but it's that creature of habit that unfortunately makes that member feel like they have to go to that hospital. Or again, same thing with buying insurance. they think that they can't get in anywhere if they don't have Blue Cross or United or Cigna or Aetna or Kaiser or whoever it may be in their community. That's the main kind of insurance provider that controls the market.
You mentioned you love the hospitals, of course, that they're a part of this equation. But go further into how you've managed to scale this and like just the vision for a Unity Preferred Network overall.
Yeah, well, in a good way, I've been able to retain some really high quality people that work for me. And another great thing about it is 80% of my staff have worked for me at all 3 networks, or at least 2 out of the 3 networks that I've already built.
Wow.
So they understood the real change and the difference of what we were doing. And because they've built themselves their own good reputation and really good, strong relationships with the provider community or the consultants that work with different provider groups or the billing companies, they were able to really retain and bring on a lot of their older relationships with hospital systems or independent physician groups or surgery centers or the substance abuse clinics that we sign up with. So it was great having them bring in that Rolodex, you could say. But ultimately, because of the responsibility that our clients that are really putting us in a role to be that primary network, we're using the claims analytics and the data, and we're forecasting where the members want to go. We're looking where they already have gone, and we're doing outreach every single day and bringing on, over 10,000 new 10,000 new providers and provider locations every single month. So
oh my gosh, that's massive.
So,
just a few, Jared?
Yeah, just a few. It's probably about, you could have, let's say, one group that's billing on one tax ID, but it's 150 or 300 different doctors, or it's a hospital system with 1,500 providers. And so we're contracting with all providers, and I'd say on a tax ID level, though, we're probably bringing in, I'd say, 1,200 to 1,800 new tax IDs a month as well.
Wow, that's phenomenal. Jared, this has been a lot of fun having you on the show today and learning more. Last question here. What's your vision for this going forward? Like talk to me. A lot of business owners, a lot of entrepreneurs, a lot of executives that listen and watch this. What's the vision going forward?
Yeah, I'm already being approached a lot by the private equity community, and we didn't raise any money for this. I have 2 other partners. We put in our own cash and didn't raise any money or seek any VC money. I think there's going to be a lot of shifts in the industry. I think that in a good way for us, our clients and other clients that we're onboarding and people that are looking at us are looking to have us be that primary network. We're already being placed on members' ID cards, so the brand awareness is getting out there. The providers want to see our IDs, our logo on the ID cards. They want to see us steer business their way. I think that AI is going to be a big part, which we're already using as well in different aspects of our business. So I don't want to see a complete takeover from AI on healthcare, but I think there's going to be a lot of things that are going to be enhanced with AI and just good things for the member and for the provider and for the overall payment process. And I think claims pricing, repricing, and just that whole aspect of the tech side and business side of it. But yeah, see us here to stay. I see us, again, becoming one of those household names and really just being the network that is the preferred choice for providers and for health plans and for insurance carriers. And it's kind of why I named the company Unity, because there really wasn't any unity amongst my competitors in the provider community. So I felt like we could bring that unity to the healthcare industry, bring that trust back, and just, again, eliminate any of the administrative headaches or burdens that fall on both sides of the insurance and the provider world.
Wonderful. If anybody that's listening that wants to follow up, they want to learn more about Unity Preferred Network, how do they do that?
Yeah, so they can go to our website. It's unitynetwork.health. They can, of course, look me up on LinkedIn. I'm on LinkedIn and actively posting on there and filling everybody in on where we're speaking at, where we're attending, where we're sponsoring. We also have our Instagram page, which is just Unity Preferred Network. And yeah, we definitely encourage people to ask their brokers, ask their health plans, why is my premium going up? Why don't I have other options? Because there's a lot of really smart, innovative brokers and health plans out there that, again, aren't just pressing the easy button anymore and signing up with Blue Cross Blue Shield. Because unfortunately, a lot of these brokers are incentivized. And again, the broker community controls the business. They control the employer. But unfortunately, Blue Cross, the BUCAs, they're really good at restricting where those brokers can sell or how they can sell. And unfortunately, when cost of healthcare goes up, premiums go up. So there's different incentives that are kind of spread out. And so just making sure that you understand your healthcare, ask those maybe uncomfortable questions, but ultimately make sure that you're in the right hands and they're putting the best healthcare options forward, because you don't, again, have to rely on these BUCAs, because they're big brand names. Yes, they're powerful entities and they're printing cash all day long. But again, what is the quality of what you're getting out of your health insurance? And that's what you got to be asking yourself.
Amazing. For everybody listening, we'll definitely put some links in the show notes that you connect with Jared and his team. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. You heard me correct. Each and every day, we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way on your journey as well. So hit that subscribe or follow button. And Jared, it's been an absolute pleasure. Thanks again for coming on.
Yeah, thanks for having me. I really appreciate it. Thanks again.